Marcelle Ruth Cancer Centre and Specialist Hospital, situated in Victoria Island, Lagos, is determined to bring world-class cancer treatment experience for patients with the state-of-the-art equipment provided by GE Healthcare, a global medical technological firm. During a tour of the facility, Mrs. Abike Dabiri, Chairman Nigerians in Diaspora Commission, commended the founders for returning to Nigeria to invest in the private sector healthcare system, having practiced abroad for 30 years. She added that the government will continue to provide the enabling environment for other Nigerians in diaspora who are experts in their field to invest their skills in Nigeria.
For a doctor to come here and set up in Nigeria at this period, despite the challenges that we complain we're having, it's most commendable. And this is inspiration to many other professionals. And a lot of people have been asking, we want to do the same thing. And so we are here to encourage her. It's going to be challenging, no doubt. I'm sure you are facing some challenges, but ultimately it's the best decision to take. To come back home, I'm not even saying giving back, but giving the best to your society. When we travel abroad, we don't get better than this. And the beauty of this is run by all Nigerians. You know, and I'm proud. Thank you for making me proud to be Nigerian. And thank you for making us all proud to be Nigerian. And that is the spirit. That is the message. No matter how far you go, she didn't have to come home. She was in her comfort zone, but she took a risk, left that zone and said, I'll do something in my community. And today, we're proud to say that, talking about investments, we have one of the best hospitals, specialty centers here in Nigeria from the private sector. So the role of government is that you have to create an enabling environment, and we have to. And good thing is that we have a diaspora policy that actually puts in place all these things you're saying can make life better for those who want to come back. And trust us, we're going to work on that.
According to the World Health Organization, by developing effective strategies to identify cancer early and delivering the best quality treatment, many lives can be saved and the personal, societal, and economic costs of cancer care are reduced. With this in mind, Dr. Modukpe Elebute Odunsi, co-founder and CEO of the center, affirms a commitment to bridging the gap and improving cancer treatment services in Nigeria with a team of experienced Nigerian specialists.
You see the issues where patients access care, but it's so disjointed. You come and see a doctor somewhere, then they go and find a specialist somewhere else, you do your blood test somewhere, you do your scan somewhere else, and there's no cohesiveness. So that was the biggest thing for me, was to make sure that on this site, and you'll see it today, we have both the outpatient clinics, we've got 7 of them, and we've designed the whole place in a way that feels like a home, that we think that promotes healing from the time people walk in through the door. So we've got the medical side, the outpatient clinics. We've got a day unit where people come for transfusions, infusions, chemotherapy. Or for example, the patient I was seeing this morning who needs observation for a few hours can be observed in that setting, and you'll see how nice it is. And also in another building, we've got the theaters, so we've got 2 theaters. We've got all our imaging on this site, apart from MRI, so we've got CT, we've got the most state-of-the-art mammogram that's available, which does better because patients can actually apply the pressure themselves and we get better images. We've got 64-slice CT scan, and of course our baby, as we call it, or the most important part that we brought back was a linear accelerator machine, which is something that delivers radiotherapy to patients. And that's why we decided to actually go the extra mile and really invest in everything that we needed to make sure that any patient that comes here doesn't really have to go anywhere else. If they need a biopsy, we do it here. If they need chemotherapy, it's here. Surgery, it's here. Everything is done here. But it's also done because infrastructure is important. The skill set is another, and we spent a lot of time. I mean, the nurses we have here, the radiographers, everybody, the pharmacists, the whole team, we're doing a lot of training to make sure that we're all functioning at the top level that people would expect if they left the country, because that is what Nigerians deserve. But we also deserve to have it delivered here at home.
But Nigerians deserve the best. They deserve quality care. They're not different from people in England or in the US or Germany. A lot of people go to Germany or India. India is even, to me, it's worse because people have come back and told us the services and even the way they were treated there was just not good. There's no need to go to India. for your oncology care. So that's my take on it, and hopefully this is a start. She has opened it, and I know the DG of the Diaspora Commission is all for this as well. This is the whole essence of why she's there, and she knows that it's we need to bring back our own people. They're the top of everything, from Dr. Yeshiku's, the heads of neurosurgeon in England, in America, and in England. They need to come back, and they do want to come back. And so we'll be working together with the Commission to see how we can fast-track this.
The first time I came in here, the reception was wonderful, and I said, as if I'm in New York. And then I asked, who is the owner of this hospital? They said a lady that she stays in London. I said, no wonder. And the way we were attended to is as if we are being attended the same way when we were over there. And I was so happy. I've been telling people about it. I said, I didn't know there's something like this here. And why do we always move out, instead of coming in here to receive the same thing we are receiving from outside? And it makes a whole lot of sense. Instead of wasting, you can imagine flight tickets. Yes. And then even some of the things they do here, they said, we're going to relate with our colleagues over there. At least you know that what you are having is the genuine attention, and the treatment you get here is the same thing you would have gotten when you are in New York. So I prefer coming in here.
The hospital is named after the founder's mother-in-law, who died of cancer.